Hey everyone. My name's Jackie, as Jeff said. I'm a physiotherapist and an avid runner. Presenting is not my forte, and this is probably a little bit more nerve-wracking for me than being at the start line of a 200-miler. So bear with me. I thought I'd do a little presentation tonight and format it in a game of true and false. So try to go through a few things that to get you to figure out whether these are essentially a myth or a fact. And it's not moving. My slide's not moving. Okay, there we go. Thought we'd start off with a little meme that is, you're a runner when you get mad that an injury keeps you from running, not that it damaged your body. I thought a lot of people in this talk could probably relate to that. Let's get started with the first true or false question. So true or false? Running injuries are caused by external factors such as shoes, running surfaces, etc. Or they're caused by intrinsic factors such as muscle weakness, imbalances, or improper mechanics. I can't actually tell if there's actually a function, if we forgot to test this out, whether there's a function where you can put thumbs up or thumbs down. So I can't see whether anyone actually thinks this is true or false.
Jackie, there's no thumbs up or thumbs down. Oh, is there actually? Let's see.
I forgot to ask.
No, I don't think there is, but you know what? There is a chat window though. People can post in the chat window and we'll see that. Yeah.
Okay. Feel free to type into the chat and let us know if you think this is true or false. And I can't actually see it right now. But anyhow, so the answer, the burn up to that question is false. So most running injuries are caused by an increase in stress on the tissues, and approximately 80% of running injuries are caused by an increase in training volume or intensity. So essentially what this is saying is that the key to preventing running injuries is adaptation. So I heard some of this discussed last week in some of the talks last week. So essentially, no matter how stiff your body is, how worn out your shoes are, how weak your muscles are, if you're actually increasing your training at an appropriate volume, there's a good chance you can actually avoid injury. And essentially most running injuries are caused, well, all running injuries are caused by running. Although, we may deal with injuries like sprained ankles or things from falling off the curb. Any internal or external stress, the internal external stress on the body, or intrinsic or extrinsic, stress on the body causes increased tissue overload, which causes increased mechanical overload. Sorry, I'm like totally just losing it. Essentially, don't exceed your body's maximum capacity to adapt. So if you exceed your body's maximum capacity to adapt, which is essentially by increasing your training too quickly, then your tissue will become less tolerant and tend to weaken if stress is reapplied when you're in the recovery period. On the same note, insufficient stress will bring on deconditioning of the tissues and make them more fragile if you're not stressing them often enough. So to adapt, strengthen, or maintain your tissues, you essentially want to apply minimal but frequent stress to your tissues. So when you talk about running, it's a pretty weight-bearing sport. So essentially we talked about this, or I heard people talking about this last week, but training volume increase should be no more than 10% per week. And if you're pretty new to the sport and pretty new to running, or you've just had an off season, the other things you should consider are things like if you're adding intervals or hills to your training, you might actually want to decrease that 10% because the intervals and hill training will increase that mechanical load as well. So just really thinking about how you're progressing through your training and allowing your body to adapt. There's lots of runners who have really terrible running technique, horrible shoes, and it can get through an entire season if they have a really good training regime and are consistent and following the training rules. So essentially have a well-planned training or get a coach. So I just threw in a few memes in here just to keep it interesting. So essentially this is, if you don't appreciate something until it's gone. So you don't really appreciate, here's walking, but you don't appreciate running until you can't do it. True or false? It's better to run 2 to 3 times per week and cross train with cycling or swimming than to run 6 times per week. Anyone have the answer?
I'm gonna say true.
Answer is false. So no study has actually been able to successfully quantify the optimal or ideal training volume. But what we know from the principles of running, or principles of training, sorry, is that you actually want to have more frequent stress on the tissues, just like I had talked about in the last slide. So you want to have more frequent stress on the tissues in order to facilitate the adaptation. So cross-training isn't bad. I'm not saying don't cross-train. Cross-train is especially helpful when you're injured. It can really help to maintain your cardiovascular volume and cardiovascular fitness, and it can help like things like cycling. Like cycling uphill can really help with like facilitating glute strength and all of those nice things. But when it comes to training volume, if you're someone who's only training 2 to 3 times per week, you can probably take that volume that you're doing in those 2 to 3 days and spread that out over anywhere between, like, ideally 5 to 6 days. Even if that's like means that one day you're running for 15 minutes and then you're getting on the bike for an hour, because the more frequent stress tissues like, so a lot of running injuries, if you're familiar with running injuries, are tendinopathies like runner's knee and Achilles tendonitis and those types of things. And tendons adapt more if they have less intense and more frequent stress. So just breaking that volume up and spreading it out. So I had this is an injury story, but I had a ITB injury that was pretty nasty when I was training for the Boston Marathon. And I could not run for more than an hour and 15 minutes without pain. So I was really stressed because I really wanted to finish the marathon. And so it had been suggested to me by someone to start breaking my training out into, instead of doing that long run, and if anyone's trained for a marathon, they're usually really structured training. So on my long run, I had to start to break my long run in 2 and do like maybe 20K or 15, 20K each day instead of that long, like 36K or whatever it is. I haven't done a marathon so long, I can't remember. But I started breaking up my long runs and going for more frequent runs during the week. And I was not sure about this. I thought, oh God, I don't know if this is going to work. I have no idea. This goes against everything I've like been taught, because it was 20 years ago. And I had the best marathon. I felt great. I was a minute off my PB and it was awesome. So yeah, sometimes you have to trust advice that you're not so sure about. I just threw in a bunch of these so people can probably relate to them. So recovering from an injury, AKA stuck inside and secretly hating everyone who is running. We've probably all been there at some point. So next, true or false? Shoe cushioning prevents injury by decreasing shock distributed to the body. Anyone want to take a stab at this one?
False.
False. Yeah, it's false. So there's no evidence to support this claim. I'm going to just give you full disclosure. I run in Hokas and have for about probably 10, 15 years. But there's no evidence to support that the extra cushion actually prevents any type of injury, and that it's actually the opposite. But cushioning doesn't change the stress on the skeleton. The body adapts its own cushioning based on the hardness of the shoe. So when we're looking at the shoe companies like to lead us to believe that we need all our fancy stuff. But since we've introduced and shoes have gotten thicker and thicker and more cushioning, it's actually caused most of us to, it just changes your running mechanics and actually causes us to heel strike. And our feet have become weaker, and so we just are essentially become lazy runners. So some of the suggestions around this are, I mean, I'm not telling everyone to run in minimalist shoes. I run in Hokas, but run in the shoe that gives your feet the most room, allows your toes to move, allows you to feel the ground the most, as much as you're comfortable with. Yeah, just kind of, if you're already running in a shoe you're comfortable with, there's no point in changing unless you actually are getting injured. Other tips are also like, you want your feet to support you. So a good foot strengthening program is a great idea. I can tell you I don't do enough. We'll do a little exercise later in the talk with respect to this, but things like, if you're wearing cushion shoes and they're great for you, some of the things you can do to strengthen your feet is walking around bare feet as much as possible, doing foot exercises like scrunching up a towel, just like some simple things, rolling out your feet, just being really kind to your feet. They're the thing that you need your feet to be a runner. I'm not going to spend too much time on this, but this is just a little diagram or a little graph that essentially also some people are like totally blessed runners. They can run at a brick if you put it on their feet. You got those people who could probably run 10K in a ski boot. And then you've got the people who are so sensitive that, no matter, they have to run in a specific shoe in order to be comfortable and in order to actually be able to run any distance. So it's just really to tell you different strokes for different folks. And true or false? Hills and hard surfaces increase the risk of injury. Anyone? That one's pretty easy. All right, just give you the answer. It's false. So no surface has been found to actually cause injury. Having said that, some things you want to keep in mind are if you're always running the same direction on the track, it's going to put more stress on one side of your body. If you're always running on the same side of the street and there's like a little bit of camber or things like that, there's going to put more stress on one side of your body. If you're going to add hills to your workout, hills increase the work of your posterior chain, like your Achilles, your calves, your hamstrings, your glutes. And then running downhill will increase all of your braking muscles, like your quads and shins and all of that. So just keep in mind, if you're adding these things, if you're adding hills, if you're adding downhills, workouts, they're awesome to add, but add them slowly. So add them progressively, and don't run 20 hills in one night when you haven't run hills in an entire season. And other things like if you're changing surfaces, so running the road is not necessarily going to cause an injury, but if you've trained for 50K on a trail and then you decide you can run 50K on the road, it's not likely to work very well, because when you're on the road, most road running is is generally a flatter surface. So most people are marathon training because they want to run a flat, fast marathon. But if you're running flatter surfaces and you're used to running trails where you've got some hiking involved and you've got some uphill and some downhill and all of that involved in there, and then you switch to running some road, that's going to road will actually have you using the same muscles and using the same patterns over and over again. So if you do have a pattern that's not as optimal, there may be a little bit of challenge there. You may be more apt to get injured. But, you know, and trails also, I'm a trail runner. So trails increase your body's proprioception and change the muscle work and the shock absorption that are happening in your body at the time. So I'm not saying trails are better. I prefer trails personally. And there are some benefits to that. True or false? Flat feet or another anatomical abnormality place a runner at a greater risk of injury. Anyone? All right. So just keep going. It's also false. So anatomical abnormalities and biomechanical irregularities are not predictors of a running injury. So just like I said in the beginning, essentially the key to this whole talk is adaptation, is your body can adapt as long as you follow the rules of training. So I have flat feet. I've had flat feet since I was born. I've had some injuries, and generally those injuries have actually been, I've rehabbed from those injuries generally with more functional training and glute control exercises, as opposed to you know, changing my shoes or doing something to my feet. So your body can adapt. If there's things that are going on, like if you're a pronator because you have a radiculopathy coming from your back, it's a different story. So you need to actually rehab your radiculopathy, and probably running's not the best way to do that. And you can look at issues, like specifically if you are having issues, you can look at the issues specifically by looking at the foot, but then also looking all the way up the chain. So, you know, looking up to, you know, are you rotating the same direction on both sides? Are your glutes working the same on both sides? And those types of things, rather than going straight to try to solve that flat foot problem, which you've probably adapted to long ago. Typical trail running injury. Anyone done this? I certainly actually have, and had stitches in my face. So thought I'd just throw that in there to just demonstrate that all trail running injuries are not lower body injuries. True or false? Orthotics or orthosis can correct biomechanical issues and prevent injury. Anyone? On the same theme. So studies have not shown long-term benefits to orthotics, and there can be some short-term benefit with certain pathologies. So things like metatarsalgia or neuroma in your foot, or things that are like really specific, but they're usually short-term. So if you have, so I had, when I was actually in physio school a long time ago, I actually had some tendonitis or Achilles tendonitis. I think I have Achilles tendonitis and plantar fasciitis or something like that. And I went to see someone. They put me right away into, I think I went to see a doctor. They put me right away in orthotics. I wore those orthotics for a very short period of time. I eventually threw those away. I also used to be put into stability shoes all the time. So be careful if someone tells you you're a pronator and puts you in stability shoes to correct your pronation. I forgot to say that in the last, one of the last slides. Your body, if your body's adapted to that, you may not need to correct it. So, and especially correcting it with shoes or orthotics, you have to think about what's also going on the rest of the way up the chain. So, not saying orthotics are like, you should never have orthotics, but they shouldn't be your first line of treatment. So going to see someone, having them look up to see, looking at your feet, looking at your entire chain, watching how you move, and just trying to facilitate a better movement pattern with you, as opposed to going straight to orthotics, is generally the best line of treatment for essentially anything. And then, yeah, and if you do have like a metatarsalgia or sesamoiditis or some kind of stress fracture that could benefit from short-term orthotics, then of course. True or false? Stretching before a run can decrease delayed onset muscle soreness and prevent injury, as well as improve performance and post-run recovery. Yeah, no? So it's also false. You got my theme. So stretching pre-run, the stretching literature changes all the time. I think it's probably changed a few times in the last 10 years, but current literature says stretching pre-run does not decrease the risk of injury and may actually increase the risk of injury, especially static stretching. Stretching has no influence on post-run pain or recovery. Pre-run stretching has been found to have a negative impact on speed and performance. However, regular stretching done separately appears to improve performance. So, if you do it, if you're stretching, you pick an hour of the day, like you get up in the morning and you have a regular time of day that you stretch, or you stretch before you go to bed, or both. I personally think would be best. Not that you should do as I say and not as I do. Or adding things to your routine like yoga or Pilates, and also just having, someone, if you see a professional who will be able to tell you like areas where you might benefit from regular stretching. Essentially the research currently says 5 times 30 seconds stretching muscle groups on a regular basis is what they think we should be doing now. If you have a job where you're sitting 10 hours a day, that's probably not going to help you. So thinking about, getting up during the day and finding some times that you might take a few stretch breaks during the day can also be helpful. Because the other piece about injuries, if you're spending 10 hours a day sitting, you are going to develop or likely to develop some tension in various areas. Even the lion needs to stretch. This is, and there, oh yeah, the cat, it's downward cat. So true or false? Running causes knee arthritis over time. So there's actually no evidence. I get asked this question a fair amount by people, not people who are runners, actually, mostly people who don't run and think that our knees are going to fall apart. There's actually no more incidence of knee arthrosis in runners than there is in the general population. So you might, a lot of us who are runners now may not have been runners when we were younger, and we may have played a lot of contact sports. I was a basketball player growing up, so we may have developed some injured cartilage due to some of the contact sports we played, but cartilage in a runner's knee is thicker and stronger than that of a sedentary person. So next time your non-running friend asks you about your knees, you can give them this information. It has adapted to the mechanical stress over time, and as applied gradually and within the tissues, they have the capacity to adapt. So more cushioned shoes don't decrease the impact to our knees, but I said that already. And then a traumatically injured cartilage, so the cartilage we might have injured in our contact sports does have limited potential for healing, so that we're not likely going to fix by running, and we may have a higher incidence of arthrosis if we've done some damage there, but specifically running itself does not. True or false? Anti-inflammatories help the injured runner control inflammation and return to activity more quickly with no impact on the tissue. I hope you all know. I hope you all know that that's false. Inflammation is a natural and necessary response to injury and a normal part of the healing process. Anti-inflammatories prevent this normal response and cause tissues to be more vulnerable in the medium term. So when I first started trail running quite a long time ago, ibuprofen was called vitamin I, and people took it for everything. You took it for, just because you were sore after a run. You took it before a run so that you might not be sore. Studies have found poor quality tissue when using anti-inflammatories as they're preventing the natural part of the healing process. So just be aware. The other piece is if you're doing really long races, like if you're doing a 100-miler or 200-miler, ibuprofen can be really hard on your kidneys. So just be very wary. And also just remember, people are very afraid of inflammation. Inflammation is not a bad thing as long as it's, from a controlled, you're following training guidelines, or you've had an injury and your ankle is swollen. You don't need to stop that from happening. It actually has some benefit, and it brings the cells to the area that are actually healing and creating new tissue. So there was a contest here, but we had to take the contest out because we actually have no way of getting everyone the prize. So my challenge was for everyone, so this is along the lines of the foot strengthening that I talked about earlier. So the challenge is for you all to practice on a regular basis, writing your name with your foot. I did actually do it before, and so this is mine. It's very pretty. I don't know if you can actually see it, yeah. So so just this is a basic calf stretch. This is Achilles. Or calf raise exercise, and some balance. Not all of us have a balance board, but I've had lots of patients make them in this age of telehealth, so feel free. And try the name writing. It's kind of fun, actually. True or false? I'm almost done. If I sustain an injury while running, such as a sprained ankle or knee, I should immediately use RICE, which is rest, ice, compression, and elevation. Anyone? No, it is false. So if you sustain an acute running injury or just an acute injury in general, the acronym you should use is MOVE. It's actually a really challenging acronym to remember, like what each piece of it means, and I forget it all the time. But essentially it's movement. So move the area within pain-free range, don't rest. So, if you've sprained your ankle, move it within the limitations that you have from pain. So you can bring it, you can invert it, evert it, flex, extend, or plantar flex, dorsiflex, elevate it, but you don't want to completely rest everything. Options. So this acronym is a little bit of a stretch, but it exists. So options such as cross training. This is when cross training is really valuable. So you might want to get on the bike. You might need to do some pool running, which is everyone's nemesis. But getting back to doing some form of pain-free activity can be super helpful. Very rehabilitation with strength, balance, and agility drills. And so I'm guessing most people on this call are trail runners. And so strength, balance, and agility are key to getting back to trail running. So we need to navigate, rocks and all kinds of obstacles. So just making sure that your rehab includes all of the above. And ease. So ease back into activity early for emotional strength. We all know, sitting there watching everyone else run out the window is really not that fun. And for those of us that crave exercise as our form of mental health, it can be really helpful just to get back on a bike or be in the pool or just actually get an endorphin release in any way we can. So it is really important, but also don't overdo it. And this guy has a spinal cord injury, but I thought he was really cute, and it's key. But even the mouse has to rehab. Training tips: do ramp up your training by no more than 10% a week. And if you're adding in other things that your body is not yet adapted to, you may have to go a little slower. Wear shoes that allow room for your foot to move naturally, and have your shoes as minimalist as is comfortable for you, and as minimalist as you're able to adapt to. Seek professional advice for treatment of an injury or help with muscle imbalances, or a stretching strengthening program that is appropriate and individualized for you. I have to throw that in there. I'm a healthcare professional. Don't try to correct biomechanical abnormalities with shoes or orthotics before you have an injury. If you're adapted to what you're wearing, don't worry about it. Consult a professional first. So don't use ibuprofen or anti-inflammatories or ice for your acute injuries or run recovery. And don't forget that this is all about having fun. Seeking professional advice. So I work at a clinic called Legacies Health Center, or Back in Motion. And so I thought I'd just throw all this in here. Physiotherapy, and hopefully most of you know what we do, but physiotherapy can help you to move through an acute or chronic injury. We can assess your mechanics, look at your imbalances, and give you a personalized exercise program. I put in brackets clinical Pilates because that is my current most exciting venture. And it is fantastic for all kinds of running injuries. Massage therapy can help your body to reset by flushing things out and help you to decrease any chronic tensions. You can strengthen and stretch appropriately. So it's a lot better than using ibuprofen. Chiropractors, they can help you get through an acute or chronic injury and set you up to strengthen appropriately. It just depends on, their type of practice. But I certainly have worked with a few that take various approaches, so I can't really say there's one. And naturopath, if you're having issues, so some things to remember along with ramping up your training appropriately is that nutrition, looking at your nutrition, if you're have any vitamin deficiencies, a lot of myself and a lot of my girlfriends are often anemic. So those are some things to pay attention to. Naturopaths can give some advice in those realms. And kinesiology can help you set up a personalized exercise program that is right for you. These are just some references, and so a lot of the information that I discussed is in a book that is by Blaise Dubois. He's a Canadian physiotherapist who teaches a ton of physio courses on running. He's from Quebec. Move an injury, not race. That's just the article that information is from. There's lots of other ones, but it's just the easiest one. Legacies in Back in Motion Health, that's where I work. And Kintech, I am a member of the Kintech race team. So just need to thank them for supporting me with all of the hogas that I get. Any questions?
Guys,
I'm done.
Thanks, Jackie. That was awesome. If everybody wants to start posting their questions, I'm sure there's going to be a ton. You can post them right in that Q&A window. Jackie, but can you tell us more about how can people get in touch with you, or if they want to work with you, can they just contact?
I actually put my email on here. Sorry, I forgot. That was my next slide. There was a whole bunch of true and false on there, and I didn't see it. This is my email address at work. Jackie.Muir@legaceshealthcenter.ca. Or you can also put in Back in Motion. I just put one of them. They're both the same.
And if people did want to book to come and see you as a physio, would they email you directly, or?
You can go onto the Legacy. I should have put the website. It's legacieshealthcare.com. I'm in the North Van location. Okay. You can call the North Van location, or you can book online. Online booking, I'm only open for clinical Pilates and oncology stuff. So if you want to get in for some clinical Pilates, come on in. We have a reformer and a springboard.
So we already have a couple questions here, Jackie. One's from Doug. He wants to know more about shoe fit. So the latest version of the shoe that he's wearing has a smaller fit than previous versions. So he's really trying to figure out the right fit. he likes the feeling of being locked in from his skiing background. I like that feeling too, like a nice tight fit in my in the toe box. The general advice that he's receiving though seems to advocate more for a looser fit.
Yeah.
So is there a best practice as far as injury prevention?
As far as injury prevention, you know, if you wanted to go with a tighter fit, but make sure your toes can move, like make sure it's wide enough for your toes to move, that's probably my best advice. If you have your toes all scrunched up, that you're trying to like your plantar fascia and I mean, you'll, you know, over time, maybe you'll adapt to that. Like, you know, it's all about adaptation, but certainly like having your toes scrunched up is going to put a lot of more pressure on your Achilles and your plantar fascia, which might be challenging.
Yeah, so I guess it's okay, probably as long as it's not too tight, I guess is the thing, right? Like like
it doesn't have to be so loose that you're like that it's, you know, you're getting blisters or things like that. But just like if you have it wide enough, like I know like I really like my Torrents, my Hoka Torrents, because I actually got rid of my Speed Goats because my feet were too scrunched up, and I just really like that my feet can actually like splay.
Yeah, and I guess some shoes have more give, I guess, too. Hey, like they pack out a little bit more than others, so maybe the shoe would.
You just want to be able to like get over your first ray and like have your toes actually do what they're supposed to do, because they're the thing that's propelling you.
There's another question here from Mike. Any tips for getting over plantar fasciitis? And I think in Mike's case, I think that's a fairly chronic thing he's been dealing with. So.
So I just got over plantar fasciitis. I could tell you what I actually did. I ran 100K. So I, realistically, like I would, you know, look up the chain. So if you've just focused on your foot, I would look up the chain to see like what's going on at your calves, but then what's going on at your glutes, what's going on at your hamstrings, and then what's going on in your upper body. I have actually some stuff that happens in my right shoulder that actually translates down the chain, but some advice that I haven't totally taken this course, but I actually went home this summer to my physio reunion, and I was telling a friend of mine, because I had plantar fasciitis, and I was like, oh, I wasn't going to run this race because like I really just didn't feel like it. And I was having this plantar fasciitis and blah, blah, blah. And so I was like, but I ran the race and I really wanted my foot to hurt because I wanted DNF. And he was like, and I was like, but my foot didn't hurt enough. And I finished the race and my plantar fasciitis hasn't come back. And so he's like, yeah, I just went to this course. He's like, and they said, you know, actually putting stress on the tissue, I don't think they meant that much stress, but he's like, well, is what you need to do. So, but you obviously need to do that in a controlled fashion. That like, I would never tell my patient, just go run your 100K. That sounds like ridiculous advice. But yeah, I did some calf exercises and some foot exercises, but also up the chain into your, like what's happening in your core, what's happening up into your shoulders. Like sometimes you actually like notice when you run, you might actually rotate more one way than the other and things like that. And it's all connected. So if it's really chronic, I'd have a look at that. Also looking at your shoes, like just, you know, are your feet able to move? Are you able to, you know, and maybe you need to dial things back a little bit and start ramping them up a bit slower, which is really hard to do. I said, do as I say, not as I do. Yeah.
A lot of that upper body lack of mobility could come from like ergonomics or poor ergonomics at a desk, right? Like if
you might sit like all day like this, or there's people, you know, you don't notice, you sit at your chair and you sit like this all day, right? Or like not everyone, but people do. I was working from home for a long time and I was sitting on a ball doing all my charting like this, and my right shoulder was like super sore for a while. So you just little things like that you don't think might impact it. You know, looking up that chain to really see what's happening is if it's chronic. Like I often approach something by like, okay, you've got a foot problem. Let's do some things to like help your foot to feel better. But okay, what else is going on? Because like, if I just fix your foot, you're going to come back to me. If it's chronic, you're going to come back to me like 6 weeks later and say like, my foot still hurts, or it's hurting. It was better, but now it hurts again. So if that's happening, then you know there's something going on somewhere along the line that's not adapting.
Jackie, I have a question for you, if that's all right.
Yeah.
So I'm curious what kind of your take is on having runners in for like preventative physio, you know?
It's tough. Like I think there are lots of things we could do, but I don't know that I would change someone's running gait right off the bat. But I might look at where their tension is and look at like from a Pilates perspective, just like getting there, like things that you need for running, like looking at like your glutes. Like a lot of people, once they start downhill running, they get ITB issues and things like that because they don't have enough control at their hips. So I think those things are really good to look at and see what's going on. Do you have, but I wouldn't necessarily change someone's overall mechanics right away before they start to actually get running and adapt.
Yeah. I think one thing I've noticed with the athletes that I work with is that often people think of seeing, whether it's a physio, or chiro, or massage, whatever kind of professional they may be, that's often perceived as a reaction to an injury. It's just like people are afraid of going to the hospital. And so maybe seeing physio is a bit of a, whether it's an acknowledging that you've messed up or a weakness or something. But I kind of find that it's actually really helpful. Often we're not perfectly healthy wise or perfectly consistent, and so it can be a beneficial check-in.
Oh, totally. Like if you have we're just checking on has this improved from last time, and you might not see your physio, if that's the case for prevention, I might give you a program, and I might not see you for another month. It's not something I'd need to see you every week for, sort of thing. Totally. And they do your home program. And it's also, the other thing I didn't mention was it was mentioned last week, was all the strength training. That's a really important part of helping your body to be better at adapting and absorbing shock. So if you can, all the stuff that Janelle talked about last week for people who are here, getting your periodizing your strength training. I am personally not doing it in this COVID life, but that is not what I should be doing.
I have actually one more quick question. You mentioned that the literature is now telling us that especially static stretching is bad before a run. And I'd imagine that's mostly because of it's a cold muscle, you're removing that elasticity. But what is good before a run? Like foam rolling? What can we do?
So stuff those warm-up drills for running, the not dynamic stretching, but high knees and heel kicks and those weird running exercises where we I haven't done them for a little bit, but side steps to just get your glutes going, and grapevines and all those kind of warm-up exercises. It is important to warm up. I know none of us do it as much as we should, but those are the things that will help you, and just things like strides, or getting you, I can't do it, but there's this one exercise where you kind of plant your foot through the floor. I can't do it on this computer, but yeah, just kind of those kind of dynamic warm-up exercises are better at the beginning of a run.
Yeah. Awesome.